when public health really gets busy doing something that takes their full attention away from like the everyday happenings, Extension's right there to support and help public health. And sometimes it doesn't feel like there's anybody out there to support that special niche, but Extension gets it.
There's a good chance that you or someone you know has benefited from at least one of the services provided by the local county health department. In Kansas, there are 100 local health departments, each governed by a local board of health, generally the Board of County Commissioners. On today's Sound Living, understanding public health and the relationship it has with Extension, now and moving forward. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman. Kansas State University Associate Professor and Extension Specialist in Youth Development in the Department of Applied Human Sciences and the Kansas Health Foundation Distinguished Professor of Health, Elaine Johannes, and I recently visited with Shelly Schneider, a state public health nurse specialist with the Kansas Department of Health and Environment, about local public health departments, their primary duties, and the connection with K-State Research and Extension. Shelly, first off, maybe just some background on what local public health departments do, and really maybe even how many there are across the state.
So there are 100 local health departments across the state, and those health departments cover 105 counties across Kansas. So that means that 2 of our health departments are a multi-county health department, meaning that they just have one hub, but then they cover several different counties around them. And each of our health departments kind of look a little different. Some are, as you can imagine, very large in the Sedgwick, Johnson, Wyandotte counties. Some are incredibly small, where they may have a staff of 1 or 1.5. And so every health department needs to make sure that they are meeting their county's needs, but still, have enough people in their brick and mortar buildings to where they can get what's required to be done as well. So every one of them looks different. They're mostly located in the county seats of each county, but that can vary as well.
So that means travel for some people then when they're trying to get to the local health department?
That's right. Some counties have a lot of windshield time to get to your local health department. Some not so much. Kansas is a pretty mile-driven state, and so I know it's funny when I'm on calls with some of the people that have helped us throughout the COVID pandemic, when we say that sometimes driving 15, 20 miles one way isn't really a big deal, and that blows their mind. But out in frontier and rural Kansas, that's just something that people just understand has to be done to sometimes get to services.
Mm-hmm. Shelly, I might just add that's a common issue between your system of public health and our system of extension, the distance. We have offices that have quite a few staff, but then we have those similar to you guys that have 1 or 1.5. What I also like what you said earlier about the tradition or the history, historically, public health has one office in every county. Well, see, so does Extension historically. And I like the fact that public health has a strong history in our state. Tradition, if memory serves, some of the early public health initiatives, almost like 100 years ago, originated in Kansas for the health of all. And Extension has that strong historical perspective, too.
I agree. I think it's kind of cool when you look back on the history of public health in Kansas and understand how it really impacted the whole United States on the development of other states and what public health looked like in the other states. And I'm sure Extension led the way as well.
You were kind of talking about the fact that they all have some primary duties. Are those set at the local level, or are those something that comes down from KDHE?
Well, there's a lot of choices that public health makes, and it might be easier to understand a little bit if you understand how public health is delivered in Kansas. So there's what's called centralized and decentralized public health departments, and then there's a hybrid of both, meaning that some states do both methods. Kansas is a decentralized health department system, meaning that decision-making and authority is based at the local level, so the local health department. When you have a centralized type of system, that's when it's done more at the state level, which would be like KDHE. And so how it looks now is KDHE provides guidance and support and programming, and then the local level can opt in or opt out in what they want to do. But you always have to remember that a lot of what drives public health is in the Kansas statutes as well. So there's some oversight that has to be followed regardless if your local level wants to kind of participate or not. You know, there's rules. Everybody has to follow some kind of a rule, I guess, is the takeaway on that.
So what then might a typical day look like for either one of the health nurses or maybe even administration?
Well, I worked as an administrator in a local health department, and public health can range anywhere from, WIC services, which is women, infant, and children's nutrition. It can go all the way through air quality, nuisance violations. It can be obviously immunizations and making sure you have good health in that aspect. It can have maternal child health programming. It can have family planning services. It can have chronic disease risk reduction services. It can offer a whole lot of pregnancy-related programming. And all the county health departments across the state participate in public health emergency preparedness. What that means is it's a response. It's a public health response to fire, flood, wildfires, tornadoes, natural disasters. It responded to COVID. It can respond to a measles outbreak. So when they have a health department in their county, they can rest assured that there's procedures and policies in place to make sure that there's some kind of organized response into those kinds of catastrophes.
Kansas has had quite a few wildfires, and our producers out, especially in the Northwest, have been hard hit with some of those fires. So were your people involved out in Ellis County and Russell and all out there? How does that happen? They're just part of a team anyway, and they go out there? Or?
It varies from health department to health department, and it also varies on local government and how they work together. I know we did have quite a few responses from the health department in the fires up Northwest, but, also a couple years ago down in South Central and Southwest, they had quite a few prairie fires. And that's kind of new to Kansas a little bit, just the vast when they get going and they get just out of control type of fires. And so public health is responding by learning more how to respond, like what is our role in that? How do we support other systems in the county to make sure their needs are met? We may not have anything as public health people have anything that can help with air quality, but we also serve, much like Extension can, with educating the public and giving heads ups and knowing what you can do or change in the way you live in your community to respond to those types of activities.
Is that one of the main connections then between Extension and public health directors and nurses, is the fact that they can contribute to that educational aspect?
That's one of many main things, and the thing that I love about public health and extension, and I'm learning every day now that I'm at the state level, even how more opportunity lies in such a great partnership, is that when public health really gets busy doing something that takes their full attention away from like the everyday happenings, Extension's right there to support and help public health. And sometimes it doesn't feel like there's anybody out there to support that special niche, but Extension gets it. And so I think there's, a lot of opportunity to build robust relationships in that capacity across the state.
Shelly, with that in mind, what are the challenges that you think we should be anticipating?
So being a citizen, and a resident, and not only being a part of the public health system, but also utilizing the public health system and being a nurse. I have a lot of opinion on that. Our healthcare system in general really was hit hard by COVID. Not only was it, illnesses, but we also had a large amount of people retire or leave the health field. So trying to build our capacity up to make sure we have people that really want to become nurses and doctors and respiratory therapists and aides and just on and on and on. Anybody that wants to participate in health is welcome because, we felt a huge attrition and a shortage across the board in health. But then to be more targeted about that, public health felt a huge hit to our staffing and infrastructure. There was a lot of just deep wealth of knowledge that we had leave public health in Kansas for various reasons. You know, it could be retirement, it could be just other opportunity, but nonetheless, we have a lot of open positions. So right now, public health, you know, kind of on the forefront currently is just trying to build the staff back up again. And what does that look like? And what education do we need? And what, as a system, do we need to look at altering just a little bit to make this more of an inviting environment? I love the work. If you get bored, this is the place to come because no day is ever the same. And the people you get to collaborate with and meet along the way are truly just amazing people. You know, I never thought this is where my career would take me, and now I can't imagine being anywhere else. And so that's the biggest impact right now for public health. And if we don't have enough people looking out for all the things that as a citizen we take for granted every single day. My spouse is a farmer, and so, you know, they hear me talk about public health, but they know that people just have it handled. If we start having a decline in public health offices and workforce, people are going to start feeling that, and it's going to be a thing that nobody can take for granted anymore. And that worries me. I mean, I feel like public health needs to stay as robust as it was 50 years ago.
And Shelly, I will just say I'm so grateful that you are still in the state because so many people have left or moved to other states. And you are absolutely right. You know the community, and now you know the state system. And so it's a privilege to work alongside you. And you aren't going to move, so the you're staying in the state.
Yeah, as long as we farm, we're not going anywhere, I guess. And that's one of the cool things about, you know, extension and public health in the sense that, you know, out in rural and frontier worlds, we're kind of part of the soil. You grew up here, you live here, and hopefully people that leave come back here, you know, and so you kind of have to grow up your own staff sometimes. And I think extension does a really good job of that. And I'm really hoping that public health can take some lead and take some direction as well and do the same.
Another thing that's kind of similar is extension is sometimes the gateway for some people, and I think that the public health system is kind of the same way because a lot of times that's where someone gets their first immunization, maybe their first introduction into healthcare. So all of that kind of plays a role as people move forward. And I know that you also work with a lot of elderly as well.
You know, when I was at the local level, you explained it perfectly. I always had the mindset that if it wasn't offered in our community and our community needed it, then it was our job, the health department's job, to figure out how to meet it. You know, like be that safety net under all the programming in the community. So if everybody kept falling through all those nets, we would be the final place to catch them. And unfortunately, that's not been able to be a lot of what the public health has got to work on because COVID truly took up all of their time for the past almost 2 years. And that was hard. And I don't want to bring this back up to the forefront, but we are heading into a world where nobody has been untouched by COVID. So moving forward, we have to figure out a new way to deal with our systems that we have and our resources that we have and move forward with that. So I think it's imperative that people understand that the health departments are doing what they can with the people they have, and they do have a lot of responsibility on their shoulders. And so having that extra little bit of support from, you know, extension just helps. I mean, I just can't say that enough. It just helps.
That's Shelly Schneider, a state public health nurse specialist with the Kansas Department of Health and Environment. More information regarding KDHE's role in public health is available online at kdhe.ks.gov. Also on today's program, Kansas State University Associate Professor and Extension Specialist in Youth Development in the Department of Applied Human Sciences and the Kansas Health Foundation Distinguished Professor of Health, Elaine Johannes. Information on health and well-being programs offered by Extension can be found online at ksre.ksu.edu or by visiting local county and district extension offices. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman, and this is the K-State Radio Network.